The Larry O'Brien Trophy has been making the rounds ever since the Raptors took the throne as world champions, but perhaps today's visit here at Toronto General Hospital a little more impactful for longtime Raps fans who are also transplant patients who've overcome the unimaginable.
I get to be a part of history and see Toronto win the trophy.
Some of the bravest and most inspiring people have placed their hands on the NBA championship trophy. And no, I'm not talking about Kawhi, Lowry, or Drake, but others you may not have heard of. They are recovered and recent organ recipients at Toronto General Hospital.
I get to be here today and celebrate and have new experiences, all because somebody donated their lungs for me.
Being a transplant patient is a roller coaster ride, from getting the diagnosis to waiting for that life-changing surgery. These patients have gone through a unique shared experience, and now they're all on the road to recovery, healthy and grateful.
Within 2 years, the disease was so aggressive, I was in a desperate struggle.
And look at you now.
And look at me now.
Look at you now, standing right next to a championship trophy.
Isn't it amazing?
So on a day like today, there's even more cause for celebration. With caregivers, doctors, and nurses by their sides, many got to touch, see, and feel a crucial piece of history.
I didn't expect to actually to see it or even to touch it.
What was most exciting for you?
Probably touching it.
Why?
It's kind of cool because all the other players touched it.
The trophy wasn't the only Raps hardware in the transplant unit.
Like that make
way.
a fist, and then you turn
That way?
that way.
Oh, because it's about what people see.
What other people see.
Several blinged out championship rings were also in-house, including one on the fingers of the Raps superfan, who for a change was starstruck himself.
They are the true champions, actually. You know, with the nurses and the doctors who save lives.
But amongst all the fun today, a moment of gravity. According to Public Health Canada, in the last 10 years, the number of organ donors has gone up by 42%. However, there's also been greater demand for transplant surgery. Recent data states that there are over 4,500 people in the country on the wait list.
Signing up to be a donor saves up to 8 lives and even more, and it's just an important thing and process for people to do, and it saves people like me and gives other people another chance at life.
The trophy will also be visiting other units in the hospital, including one patient who is getting a new heart today. Ahead on City News, a pioneering clinical study that's not only saving lives, but could be the answer to the dire shortage of organ donors. It's Raptors mania here at Toronto General Hospital, a treat for patients and doctors who most recently took part in a pioneering clinical study. It's being called an optimistic approach to a significant problem in the medical field.
October the 4th, 2017.
Wow.
I consider that my second birthday.
That date is etched in Stanley DeFreitas' memory, and the 74-year-old can't help but reflect on where he was just 2 years ago, desperate for a second chance at life.
My life was down to weeks, so I got one lung. I grabbed it just in time.
That surgery came with conditions. The donor lung was infected with hepatitis C, and in the past, organs with the virus were not viable for transplant.
If all the hepatitis C organs were used in North America alone, that would mean 1,000 more organ transplants per year.
Doctors at the University Health Network saw an opportunity, and for 22 patients, including Stanley, hope suddenly arrived in the shape of a new clinical trial.
In that moment in time, there was no choice in the matter. I had to take the lungs or die.
Unfortunately, with the opioid epidemic, a lot of our organ donors have died from a drug overdose, and a lot of those actually tend to be hepatitis C positive.
About 60 patients have now taken part in the study that is now considered a regular clinical practice, the medical community deeming this groundbreaking procedure a success.
We've treated these organs outside the body, and we used light therapy to decrease and in some cases eliminate the virus from the organ.
Stanley's successful trial opened the door to other patients like Neil, who underwent transplant surgery just 10 months ago. But by no means was this an easy journey for the doctors and their patients put on prescribed medication.
I took the drug for 3 months, and they cured me after a month. But now they're only doing it for 7 days now, which is actually amazing.
And you helped pave the way.
Yeah, that's great.
I'm here to tell everyone that Hep C it's curable.
And you're proof.
And I'm proof of it, yes. So far, so good. Thank the Lord. Thank the doctors. Thank the hospitals.
Well, down the line, the doctors are also hoping to use this technology to treat organs for a whole array of other viruses, making them more safer for transplantation. For City News, I'm Faiza Amin.